See, we've got a really good number of folks here, and folks may still come in as we get started. But definitely welcome everyone to our first mini conference for the Trauma Informed Communities Project. So today we're going to discuss how to make trauma-informed change stick with a focus on building inclusive partnerships. So before we get started, just a few check-ins regarding Zoom. Please make sure you are muted when you're not speaking. We want to avoid any background noise and ensure everyone can hear. So we would also love to see you. If you feel comfortable, please feel free to turn on your camera. We will use the chat feature throughout the presentation, and we encourage discussions, questions, and feedback. You should see the chat icon in your Zoom taskbar, so you can go ahead and click on that to open the chat box. I see folks are using it already, which is wonderful. And we're all doing the best we can, so no worries about any interruptions. Please also bear with us if there are any technology snafus. And please note that the main session of this webinar is being recorded, so we'll make the video available to all registrants. We'll be using breakout rooms today as well, but as I understand it, the breakout rooms will not be recorded. So just a heads up for everybody. All right. So today you will hear from the Trauma Informed Communities Project team. Our project faculty includes Dr. Angela Tuna, Dr. Caitlin Donish, expert child welfare clinician Pam Price, and bilingual mental health clinician Sarah Skinner. And then there's me, Danielle Mears-Harrell, the TIC project manager. Our team is very thankful for the support of Terry Grant, State System of Care Coordinator at the Division of Mental Health. She's been an awesome partner in this work, and our project is funded by the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. And now we want to hear from you. We're excited to have you here. Please introduce yourself in the chat. Include your name, your community, what you are most excited for in our time together. And while you're doing that, help us also identify you for the breakout rooms by renaming yourself on Zoom. So you can find your name on the participant list and click more, then select rename, or you can click the 3-dot button on your picture and select rename. And then you'll just add your community abbreviation from the red box here to the front of your name. And that will be super helpful as we set up the breakout rooms for our activities. Awesome. So hello Joy, Candace, Nikki in Wilson County. She's excited to see some familiar names on this call. Dion Dockery of Pitt County is here. Hello, Zulena. Awesome. We have Bloomington, New Hanover showing up. Awesome.
That's great. Does anyone need us to walk through the renaming again? This for our breakout sessions. So just as Danielle mentioned, go down into Zoom at the bottom, right? And you'll see a kind of a sort of a tab pop up, and we want you to click participants. When you click participants, we want you to find your name. Okay, find your name, and then there should be if you go all the way to the right, you can see a more button, so click more. Is that right, Danielle?
Yes.
Okay, and there should be a rename. And then we want you to add these indicators here for us. If you're from Cabarrus, we want you to type in CB or Caldwell CD. Perfect. I'm seeing lots of initials.
Wilson and Edgecombe counties are represented.
And as we go, I think, Danielle, you can add, those labels as well. So if you feel like we've given folks enough time, we can go on to the next slide, and maybe behind the scenes we can work on renaming.
Next slide. So it's great to see that we have folks from all 6 of our cohort 3 communities present today. And it's wonderful to bring everyone together in this space. So in previous cohorts, the focus was on raising trauma awareness throughout each community and building skills. You can see all 6 of our communities here. And then this year, our focus is on implementation and shoring up all the great work that you've done so far. So in phase 1 of this year's project, we've disseminated a leadership engagement survey to capture any changes in your team structures and in your leadership roles, designed the community needs reassessment, which you'll hear about shortly, and started consultations to develop technical assistance plans. We're now in phase 2, enhancing awareness and practice with our project website, pre-recorded COVID-19 webinars, and virtual mini conferences. Today is the first one. So at the end of this project in phase 3, we'll support collaboration across the communities and sustainability of efforts and host a final summit. So there's much to look forward to. And so today, here's the agenda. In our time together today, we'll share the latest on the community needs reassessment. We'll talk about implementation strategies and a session on taking stock of trauma-informed communities work. We'll take a break, and then we'll come back to hear from Mebane Boyd and the Honorable Judge Jay Corpany about the awesome work that's happening in Hanover County. We will then share a framework for engaging and partnering with stakeholders, and then practice crafting our message and measuring reach. So we won't just be talking to you. The breakout sessions and activities will be sprinkled throughout, so you'll have time to start putting these concepts into practice. And at the end of the conference today, I'll provide a link to an evaluation survey in the chat. And once you submit your response, you'll be directed to download your training certificate. So I will go ahead, I'll turn it over to Sarah, who's going to lead us in a wellness activity.
Great. I'm so happy to see all of you. The communities that I work with directly, it's really great to see so many names. And then folks who I don't get as much of a chance to work with, it's just nice to connect. So to practice what we preach, we want to make sure that we start this off by doing a very simple wellness activity to center us, to remind us why we're doing the work, and to help us remember that we have to be kind to ourselves. So I'm going to lead us through a loving kindness meditation. So this is a secular meditation, but it does originate from Buddhist, Hindu, and Jainism meditation. And if anyone has any interest in where I got this particular loving kindness meditation, I'm happy to send a link. So let's just get started. What I'd like everybody to do is, if you're sitting, try to get comfortable. If you're standing, also try to get comfortable. We're gonna just try to get in touch with our body. So the first thing what we're gonna do is we're just gonna notice how, either if we're standing, we're gonna notice how the ground is holding us up. If we're sitting, we'll feel our arms against the chair, back against the chair. Try to listen to your body. Try to find balance. Relax without slouching. Alert without being rigid. It might help to take a few breaths, stretch, relax a little bit. So I want you to bring your attention to your presence in this moment. Notice that your body is a living process and you are here right now. You have arrived in this moment across sadness and incalculable loss. It's been a hard year. There's also been moments of joy and innumerable gifts. You're here for the love and concern for yourself and your community, and to organize against trauma and pain. You are here. You are really here. So center yourself now in your deepest aspirations for this time together today. What is it that you want to encounter in this time, in this moment? What opens your heart and brings forth your love, your joy, your creativity, your passion, your fierceness? Bring your attention to your breath and to the beating of your heart. If it feels natural, place the hand on your heart or your stomach and take a deep breath. Now wish for yourself whatever good things support your well-being. Bask in the wonder that you made it here today. Recognize your worth using the following words like these or any words that touch your heart. So in all of our separate spaces, I want you to think to yourself loving kindness, kind words, or perhaps these words in particular. May I be safe. May I have food, shelter, and friendship. May I have health in my body. May I care for and appreciate my body. May my heart be open and free. May my wounds, inner and outer, be healed. May I be generous, creative, and caring. May I receive the generosity, creativity, and care of others. May I be equal and free. Now call to mind this particular group, our shared experiences and commitment to resilience and trauma-informed care. Recognize our worth using words like these or whatever words touch your heart. May we be safe. May we have food, shelter, and friendship. May we have health in our bodies. May we care for and appreciate our bodies. May we honor our own strength. May our hearts be open and free. May our wounds, inner and outer, be healed. May we be generous, creative, and caring. May we receive the generosity and creativity and care of others. And may we all be equal and free. And finally, calling to mind the vision of transformed communities. Send this energy to all the members of our communities near and far. May all of us be safe. May all of us have food, shelter, and friendship. May all of us have health in our bodies. May all of us care for and appreciate our bodies. May all of us honor our own strengths. May all of our hearts be open and free. May all our wounds, inner and outer, be healed. May we all be generous, creative, and caring. May all of us receive the generosity, creativity, and care of each other. And may all of us be equal and free. So pause for a minute. Take a breath. Savor and be nurtured by this kindness that you demonstrated to yourself and to your communities. And let's begin. Okay, we're going to go to the next slide. Okay, Danielle? All right. So with that loving kindness meditation in mind, let's talk about what got us here. So we're going to talk really specifically about what our goals are for this year. So the community needs reassessment is a core activity and implementation strategy of the TIC project. I like to call it the TIC project. I realize that perhaps I should say trauma-informed communities, but the trauma-informed communities project. So each participating community completed a needs reassessment survey during the first year of participation in this project. It's a needs assessment, just as a reminder, this is a process to determine areas of strength and growth and also some areas of need regarding system-specific trauma-informed practices. So to launch Cohort 3, we sent out surveys to the senior leaders in each community in July to identify and vote on the 3 trauma-related domains that were most in need of a needs reassessment. So senior leaders consulted with their county collaborative members and selected the domains that they would like to include in the reassessment. And these were the ones that were options. So in the next slide, we'll see that these were the 3 that you guys voted on to have included for needs reassessment. So based on the survey results, you guys chose level of agency communication and cultural support, level of trauma-informed approaches and supervision and peer support, and barriers to trauma-informed practice in our community. Just to go over that, what that might mean for you guys, when the needs reassessment survey comes out, which we'll be launching very soon. Caitlin just finalized it, I think, last night. It looks awesome. We're going to be sharing the survey, and you guys will be spreading it through different stakeholders in your communities to determine the areas of strength and growth for each of these domains. And so we'll be assessing for, are there, in terms of cultural support and communication, do you guys feel like your community has areas of strength or growth in promoting active participation of caregivers in assessment and treatment? Making diligent efforts to prevent re-traumatization or exacerbation of traumatic stress symptoms in children and families. Making repeated efforts to understand each family or child's unique cultural perspective. In terms of supervision and peer support, we're going to be looking at things like, are there opportunities for training on self-care and how caring for children who are exposed to trauma can impact professionals and caregivers? Whether our agencies in our communities are routinely addressing the impact of working on survivors of trauma on staff during staff meetings, prioritizing staff development and retention and overall wellness. And then for barriers to trauma-informed practice, we're going to be looking for if there are, what are the barriers that are preventing communities from being able to provide trauma-informed care and practice in the community, like insurance issues, transportation barriers, lack of support within the agency, siloed efforts, which is a common problem, a lack of understanding of service system differences. So I think with these three, I'm really excited because these cover so many different domains for trauma-informed care. And I was excited that these were the three that you guys chose to reassess for the survey that's coming up. So on the next slide, though, I want to point out that we actually decided to add 2 more domains because we can't do anything but extra. So in conversations that we've had with each of our communities and with just with ongoing current events, we discussed as a faculty the importance of making sure that we are directly talking about including racial equity and creating meaningful partnerships as part of our approach to trauma-informed care. So we understand that trauma-informed practices must intentionally include efforts to address racial equity. Part of the needs reassessment is going to include questions to assess for strengths and areas of growth for your communities in recognizing racial trauma as trauma itself, so racism as trauma, and combating white supremacy and racism. That's one domain we're going to be adding. And then similarly, the needs assessment is also going to include questions to assess for strengths and areas of growth for engaging youth and families in meaningful partnerships. So we know that trauma-informed communities actively partner with families and youth in the community to ensure that they have a voice, meaningful representation in all service systems. So we did add these 2 domains based off of conversations that we've had with you guys. You guys raised really, really good points. And then for us as a faculty, we really wanted to do a deeper dive in this work. So I'm excited to partner with you guys and to get a sense of what are the areas of strength for each of your communities regarding trauma-informed care, and what are areas of growth. And then that will lead us into strategic planning of what are we going to do to keep the good work that we're doing going and what is needed. And I think too, it will be important as stakeholders and communities answer these questions, keeping in mind how COVID has impacted this. When you guys started this project, COVID wasn't even on the horizon. And now we're in a very different situation. We're in a virtual conference as opposed to an in-person conference. So that's going to be important for us to keep in mind in terms of these conversations around sustainability. So I think we're excited, and Caitlin is going to walk us through what it means to do around implementation science. Caitlin is an incredible implementation scientist, and I'm excited to talk a little bit more about what this is going to look like.
Thanks so much, Sarah. Before we get started into implementation, I'm curious, does anyone have any questions about the needs reassessment? We will be sending out emails to community team leaders and service system leaders with the evaluation link. And just like we've done in the past, we're going to rely on you to be able to reach your community. So I want to take just a couple of minutes, and Sarah, feel free, to jump in here. Does anyone have any questions about the needs reassessment? You can type it in the chat box, unmute yourselves.
Caitlin, hi, this is Mevin from New Hanover.
Hi,
Were all the communities consistent on what they wanted, or was there was this a really strong feeling that everybody wanted this? I'm just curious how you decided on the three.
Of course. Sarah, do you want to jump in?
Yeah, absolutely. So we basically used this as a vote. We decided to make this democratic, and it was really consistent across the domains. There were a few slight differences, and I think it was New Hanover, but I believe there's one county that had a three-way tie for third place. So I think the overall feedback that we got is that I think everyone would like to assess for every single domain. But these were the three that overwhelmingly were voted on as the priorities. And again, there were a couple of times where there was a three-way tie. Any other questions?
Yes, this is Carol White. I wanted to find out if the results of this survey would be given to one person from Wilson, and that person would then share it with the remainder of us that's on the call. And who would the contact person for Wilson be, so I would know?
So typically we usually have someone who is a point person. So for the Edgecombe Wilson Collaborative, that would be Katina, and then Candace is also included with that. And so the system of care coordinators are the ones who are responsible for distributing the information and the results from the survey.
So I can contact Candace Roundtree.
Yes.
Yes. Yes, and and I think Sarah mentioned this, we'll be presenting all of this information, and to make it easier, we could also record the presentation so that you all have access to the data, and that data is going to help us sort of cater training plans and technical assistance plans to supporting your communities and in the goals that you have in becoming trauma-informed and resiliency focused. Any other questions?
I'm so glad you're in. Bo had a really great question. So loving the inclusion of racial equity and given the impacts and issues of trauma for LGBTQIA issues on youth. So we have specifically, based off of feedback from our communities, we did have a specific focus on racial equity. I will say that a lot of the tenets of providing racial equity are applicable to other historically marginalized communities, so LGBTQIA youth and families, children who experience disabilities. So however, are there going to be specific comments or questions or domains taken into account around that? Not specifically. However, there should be opportunities to be able to talk about areas of growth, and that might be one. And so with the domain that talks, and let me make sure I'm getting the wording right. Daniel, do you mind shifting back to the original domains? These, yes. Oh, sorry. Next, one more. So when we're looking at the domains, when we were talking about cultural support, so cultural support is a catch-all term, and so that can include looking at our systems being responsive to and being inclusive of LGBTQIA students and families, and students with disabilities, and other people who experience oppression or marginalization. Does that make sense?
I also wanted to put a plug in here, Sarah, if you don't mind me chiming in really quickly, with our website too, when we're looking at the intersectionality, Bo, that you're speaking to, we do have some resources that are focused on LGBTQIA youth and families and other intersecting identities like that. So I encourage you all to take a look at our website if you haven't yet. Great. Thanks, Beth.
Good. Good. All right, let's move on. Please feel free to email your CCFH faculty if you have other questions. We'll be giving you just some general directions or guidelines around distributing the needs assessment, the needs reassessment, and we're excited to start that process. So Sarah, that was a very generous introduction about my experience in implementation science. It's something that I've been really fascinated with throughout my education. One of the reasons I love implementation science is because we often wonder, how we can take science or what's been developed in the community, right, and spread it, right, or expand its use. And we know that systems and people are complex, right? And implementation science as a field is complex. And I'm just going to provide us with a pretty sort of hopefully accessible introduction to implementation science using what I think is a really interesting example and something that's really kind of pertinent to today in the COVID-19 pandemic. Thank you, Danielle. So I want to start off by talking a little bit about how we make change in systems, right? Systems that are set, with lots of guidelines and expectations and checklists. So how do we make this happen, right? How does the rubber hit the road? And I'm going to talk about hand washing first. So we know that hand hygiene, and what I mean by hand hygiene is hand washing with soap and water, right, for 30 seconds or using an antiseptic solution is the single most successful and cost-effective means of preventing a few different things. One, healthcare associated infections, right? We know that it's really simple and it's very successful in reducing infection rates in hospital settings. We also know that hand washing can decrease illness in the community that can lead to hospitalization. We've seen that with COVID-19. We also know that healthcare associated infections cost us, so the United States, $28 to $45 billion a year, a year. So it's a simple intervention, right? 30 seconds, it's pretty brief. We all know how to do it. And yet, right, it can lead to significant consequences and significant costs to hospitals and clinics. So in the chat, I want you all to do a bit of an activity. Before the COVID-19 pandemic, what proportion of healthcare workers complied with hand hygiene guidelines, right? What proportion washed their hands before they entered a room or when they entered a room and then washed their hands afterwards? All right, we've got 10%. All right, I want to see all sorts of guesses. 50%, 65%, 75%, 40%. I'm seeing a range, 10% up to 75%, 80%. Angela says 20%. All right, a hopeful 80%, says Amy. You all, before the COVID-19 pandemic, research suggested that it was 50%. So about, well done. About 50% of healthcare workers complied with hand hygiene guidelines on a regular basis. Okay, let's think about that for a second. This is a 30-second intervention that has significant evidence. We know it's effective, right? And only 50% of healthcare workers implement it on a regular basis. What does this mean for us when we are trying to make changes within an entire system? When we're trying to implement an evidence-based treatment that has, 15 different components. What about trauma-informed communities when we are working with multiple systems, right? And to make changes that last years and years and years. So let's continue with this, this hand washing example. Go ahead, Danielle. Okay, so let's think about what influences hand washing, right? So we know 50% of people do it on, average or regular basis. In the chat, what would influence someone's capacity or willingness or interest in hand washing? Time. Yes, Lisa. Yep. So do people have time to wash their hands for 30 seconds or even use hand sanitizer for 30 seconds? Social norms, more accessible hand washing stations. Oh, I think I saw like some good smelling soap. I love that. The knowledge to be able to do it, resources to do it, right? Accessibility to warm water. That's very, very important. Skin irritations, right? So there could be, an individual might not want to wash their hands if it's painful or exacerbates a rash or any sort of irritation. Convenience, scent. So think about all of these factors that might impact, right, one's interest in washing hands. So the research suggests, and you've already highlighted all these different factors. Go ahead, Danielle. That hand washing is affected by everything from knowledge, right? Training in how to do it effectively, beliefs about the consequences, right? So we know that in some healthcare settings that healthcare professionals are observed, right, in whether or not they wash their hands. It could be a professional role and identity, one's intentions or their goals, for their community or their building in making sure that they're practicing safe strategies. So we know that behavior is affected by all of these different things for an intervention that takes 30 seconds. Okay, let's keep going with the analogy. Go ahead, Danielle. So if we're thinking about hand washing and we're expanding it to trauma-informed community practice, why are we talking about implementation science? Why is this important? And, one of the things I wanted to do today was make sure that I try to stay away from a lot of academic jargon, confusing words. And I can tell you that implementation science is a new field. So it is full of jargon and confusion, and even implementation scientists are arguing about what term to use, when to use it. So this is a field that has over 61 frameworks, models, and theories. One framework offers 39 factors to consider when you're thinking of a new treatment that you want to try, or an intervention or a practice you want to try. Another framework offers 73 different strategies to consider, right? Those strategies could range from supervision, training, and then a third framework offers 17 potential outcome domains. So, right, you're trying to implement your strategy, and there were 17 different things that you could study if it's going well or not. And then we know that there are over 400 implementation related measures, 400 different measures you could use to study whether or not your change is making a difference. So it can be an overwhelming field, right? So I was trying to find a definition that would make sense and that could really allow us to have a discussion about implementation of trauma-informed practices. And this is a definition by the National Institute of Health. And let me tell you, this was not the definition that we're going to dive into today, but I want you to kind of think about how we can interpret this for use within our communities. This is a study of methods to promote the adoption and integration of evidence-based practices, interventions, and policies into routine healthcare, but we can also maybe substitute juvenile justice, right, mental health care, the court system, law enforcement, public settings, to improve the impact on population health. So Danielle, I'm going to ask you to go forward. That is not the definition we're going to use today. All right, we're going to break it down a little bit so that we can apply it to our working communities. Go ahead, Danielle. And this is something that I found to be really helpful as we think about changes in our communities, if we're thinking about partnering and then engaging with community members to help us make decisions about priorities and goals in communities. This is something that we can use as language that is shared. So here's some non-scientific language. Go ahead, Danielle. So the intervention, practice, or innovation, let's call it the thing, right? The thing could be, and I want you to write in the chat, what are some things that you're hoping to accomplish, or some interventions or practices you want to be able to use in your trauma-informed communities, in your trauma-informed agency or organization? What are some things that you want to try out? Positive psychology. Thank you, Lisa. Yeah, so you're wanting to offer that within your system. What else? What are other practices? Another example might be trauma screening, right? In child welfare, we know that trauma screening can be a really effective practice. Jane, organizational policies and practices change, becoming resiliency focused, right? So these specific policies that you want implemented. Resilient skills. Yep, so resilient skills maybe in the workforce or within student learning, staff support, and workforce wellness. That's right. So how do we prevent STS or secondary traumatic stress or vicarious trauma? Better service to the public, better way to train public service. So that is really interesting, right? So you're thinking about training. How do we train really effectively? That's great. All right, Danielle, go to the next one. So we're going to talk about interventions that are the thing. Effectiveness research looks at whether the thing works, right? So is the thing effective? And using some of your examples, is STS or workforce wellness training effective in decreasing burnout, in decreasing STS? Do we know that resiliency skills introduced, let's say in a school environment, would that decrease, children's distress? What were some of the other examples? Positive psychology. Do we know that positive psychology leads to better outcomes? Right, so we're looking at the effectiveness of the intervention or practice. All right, Danielle, let's go to the next one. So implementation research, if we keep sort of expanding, it looks at how to best help people and places do the thing. So that's what we're talking about today. How do we use implementation science to help communities use resiliency skills, use trauma screening, try workforce wellness strategies, increase trauma knowledge in communities. So that's what we're focusing on, implementation science. All right, go ahead, Danielle. So then implementation strategies are the stuff that we do to try to help people or places do the thing. So we've got implementation research, and then we're going to use really specific strategies to increase people's use of our intervention. That often looks like training, right? How many times do we train people, right, on a new policy or a new practice, right? We use training a lot, but there are many other strategies that we can use too. It could be supervision, or it could be consultation. It could be doing a needs assessment. It could be collecting data. And then the last one we're going to talk about is the implementation outcomes. That means how much and how well is your community doing the thing? Okay, how much and how well are they doing the thing? So let's try this example. Go ahead, Danielle. The hand washing example. So let's think about this when it comes to hand washing, and we're going to apply it to the example that we just heard about. So the intervention, practice, or innovation, the thing, what is the thing in the hand washing example? You can type it into the chat. What is the thing that healthcare organizations wanted to be done? Yes, I love it. 100% hand washing. They want to make sure that their professionals are using the 30-second hand hygiene practices, washing hands frequently. Right. Effectiveness research, how the thing works. How does hand washing work? right? We know it's very, very effective in decreasing infection rates. Wash those hands. Implementation research, helping people do the thing. So what is necessary for hand washing? Implementation strategies, the stuff we do to help people do the thing and how much and how well they do the thing as outcome. So if you could go forward one, Danielle, this is helpful. Okay, so let's take a look. For hand hygiene, that's the thing. We know hand hygiene is the most successful method of preventing healthcare associated infections. We know that we can help people use hand hygiene practices. That's how we help people do the thing. And we do that in all sorts of ways. We do this in trauma-informed communities work where we use training, reinforcement, consequences, and peer pressure. And then we look at how much and how well they do the thing. And with a 30-second intervention, it's about 50%. Okay. So there is one way of thinking about implementation. Let's think of one other way. If you all are visual learners, I like to use visual analogies as well, or metaphors, and we can think of it as a syringe. So the thing or the serum in the hand washing example is washing your hands with soap and water, right? That's the vaccine, that's the serum, right? What we do to make sure that the serum or the vaccine or the hand washing is used widely is all of the implementation strategies we implement, right? We use training in hand washing, reinforcement. We might use observation of doctors and nursing assistants. So we're like the syringe, right? We infuse whatever intervention that we're focused on into the community. If you can go to the next slide, Danielle. So this is the TIC project, the Trauma-Informed Communities project, right? So the thing that we're looking at are trauma-informed practices and interventions, just like you all said, workforce wellness strategies, decreasing STS, screening kiddos, or it could be using an evidence-based treatment. It could be, you know, identifying stakeholders in your community and lifting up their voices. And we do all sorts of things to implement these strategies. We do training in Trauma 101. We conduct needs assessments, just like we'll be doing later this week and into the next month. And then we develop technical assistance plans. Those are all the strategies that we use to make sure that we can meet our goals. All right, you can go to the next one, Daniel. Thank you. So with all of that taken together, implementation science examines how evidence-based programs work in the real world. By using implementation science and implementation strategies, you can help bridge the divide between research and practice and bring programs that work to communities in need, or programs that work to communities in need. And I want to kind of, you know, stop here for a second. We also know that communities often have traditional healing strategies that are really effective, right? They have ways of seeking resilience and sharing stories and thriving, right, in the face of adversity that has worked for centuries. And so we also have to recognize that implementation science might also mean identifying those strategies that have traditionally worked or that are effective in a particular population or community and expanding them, right? And sort of spreading those strategies and sustaining those strategies so that other individuals have access to them. It doesn't necessarily mean that, you know, research conducted in academia is the only way that we can identify effective strategies, right? There are many strategies that already exist. How do we expand the access to them? Exactly, Angela. Learning from communities. I'm going to go back to Jane. Jane had a question. She said, is hand washing the outcome you're looking for, or is hand washing the intervention, right, to get positive health outcomes? So the intervention in this case is hand washing. Hand washing is the practice that we want to promote, right? And so hand washing %, or making sure that 100% of healthcare workers are washing hands when they walk into rooms, that's the outcome. How much do they do the thing? How much do they practice hand washing? Does that make sense, Jane? And you can just type it in the chat. All right, let's go forward. Yes, thanks, Jane. So So that was a lot of the thing and how we do the thing and how the thing works and how we measure the thing. And so there are some very, very fancy frameworks that exist, right, to lead us to approaching implementation science in a structured way. This is one of those very complicated frameworks. It's called the Exploration, Preparation, Implementation, and Sustainment Framework. And you can see all of these different elements that you could explore within your communities. But we're not going to look at this in quite such detail. All right, Danielle, you can go forward. What we want to do is break it down. How can we use this on a day-to-day basis in your communities, in your community task forces, in schools, in your court setting, in your juvenile detention center? We're going to try something a little bit more straightforward. You can go to the next slide. And it's the same framework, right? And it's broken into 4 phases. Right? So the first phase is exploration, and that's when we evaluate needs and program fit, right? How do you even make the decision to implement the thing? How do you even make the decision to implement workforce wellness practices? Or how do you make the decision to offer Trauma 101 training? And then we're going to focus on preparation. How do we start offering this, right? How do we integrate it into our system? How do we gain internal support? Who are our champions? And how do we gain external support? And then in later conferences, we're going to talk about implementation, putting the program into place. What are the strategies that we need to use, and sustainment? How do we keep this going, right? Even when grant funding ends, right? When the champion moves out of state, how do we keep this going forward? And Amy, I'm seeing that data collection is really challenging in schools. And I hear this across all systems, right? How do we make data collection and analysis easier? And that is an implementation strategy. That's one way that we can infuse data collection, right, into schools. And we have to set up strategies and do a lot in the exploration and preparation phases in order to make that a reality. All right, go ahead, Danielle. You can go 2 clicks. Let's do one more. Okay. So this is where we're focusing today. We're going to focus on exploration and preparation. So like I said, exploration is when service systems, organizations, or anyone here on this call today, you consider the emerging or existing needs of children, families, and communities. What are the needs of your community? Let's take a moment in the chat. What are some needs that your community has when it comes to trauma-informed or resiliency-focused practices? What are communities saying that they need, right, through partnership and engagement? What are they saying that they need? Let's take a moment and sort of lift their voices for a second. Yes, affordable and safe housing. Thank you. Yeah, that's what they're saying they need. Moving forward once trauma has occurred, right? So how do you start the healing process? How do we acknowledge as a community that trauma has occurred? And how do we find appropriate resources and treatments and interventions? Housing, employment, public understanding of what toxic stress or trauma is, right? So that sounds like awareness of trauma, awareness of adverse childhood experiences or toxic stress. All stakeholders to be trauma-informed across the community. Support for anxiety-related issues that are affecting academics, that's right. So we can already identify so easily, right, what these needs of children's families and communities are, right? And then identifying through partnership and engagement and listening what those practices might be to address those needs. What are the things we do to address the needs? And so, once we've identified those needs, we go into the preparation phase, and that's when we start identifying barriers and facilitators. What I mean by that is what gets in the way of implementation, right? What gets in the way of making these practices a reality, and then what helps put those practices into place? What helps make the practices a reality? We know that oftentimes interventions need to be tailored and adapted, and then we have to develop a detailed plan, right, to use the evidence-based practice. All right, go ahead, Danielle, and we're gonna jump into some discussion soon. So we're gonna focus on collaboration. I'm voluntelling you a little bit of what I want you to focus on, because we're talking about making changes stick today, right? We're talking about partnering with stakeholders. When we look at our trauma-informed principles from SAMHSA, right, across, and this is research, and this was done through listening sessions with communities across the United States, and they found these 6 principles to be, the key elements of trauma-informed community. And we see collaboration as one of those main principles. So we're focusing on this today: promoting involvement of residents and partnership among agencies, right? We can also, we can sort of include trustworthiness here and empowering as well. We know collaboration kind of crosses all of these principles, making sure there are opportunities for growth for all, fostering positive relationships, right? We know this is the foundation of trauma-informed communities work. All right, go ahead. So, all right, so if collaboration, right, partnering with stakeholders is the thing that we want to do, implementation strategies are the stuff we do to try to do the thing. Okay, so when we think of collaboration, Danielle, you can click on the next piece. When we think about collaboration, we use all sorts of different strategies, right? And I'm wondering, in your communities, do you do any of these things? Do you convene teams? Can you go to the next one, Danielle? Do you develop stakeholder interrelationships? Can you go to the next one? Do you engage consumers? Are you doing any training or education, educating of stakeholders? These are all strategies that you can use in your communities, in your agencies, to be able to partner with stakeholders, lift up their voices, right, and increase engagement. You can go ahead, Danielle. So what are we doing today, and why does this matter, right? Today, we want to learn how to enhance collaboration and promote the involvement of residents, youth, families, community members, right, and partnerships among all of our various agencies. So some of the strategies we use include convening teams, right? We convene committees, we convene task forces, we do a lot of convening, right? And by doing that, we're developing relationships with stakeholders. We're engaging and partnering with children, families, and community groups. If we think about exploring, how we do this, it's really examining and taking stock of what our committees look like right now, right? What do our task forces look like? This may not be, if you're not involved in your trauma-informed communities work, but you're involved in work at your agency, this could be an advisory board, an executive board, right? How are decisions being made? So how do we approach collaboration? Well, we start doing some preparation. We determine the action steps needed to identify, reach out to, and partner with committee and task force members. So what we're going to do today is give you some space and time to meet with your communities. You can go forward one, Danielle. Because we know that time is such a precious resource these days, and it can be really hard to meet with your communities on a regular basis to think about inclusive practices, equitable practices. So we're going to give you time in your communities today. So here are a few steps. If you haven't already, I want you to change your name to include your county, right? And Danielle's been helping with this. And if anyone doesn't know how to do this, just private message Danielle and she'll be able to help you change your name. You're going to be assigned a group based on your community, and you're going to be asked to begin an activity. Now listen, I feel like I'm going to underscore this. Just begin the activity, because we want this conversation to be guided by you, right? There is no need for perfection here. There's no need for you to complete 15 check boxes. This activity is meant for you to just stimulate discussion. It's a place to start, just developing language around who's at the table. And I want you, and I'm giving you permission to go where the conversation takes you, right? Don't feel like you have to do what we're asking you to do. Okay, so Danielle's going to put an activity in the chat. This is something that you can take back into your communities. This is something that it might take months for you to complete. And I want you to look at step 1, right? This is just simply identifying the current service systems that are represented within your community or task force, right? You'll see a really long list of checkboxes. And all I want you to focus on is, is this system represented in your task force, right? Yes? No? Maybe you're not sure, right? And maybe you get focused on one particular system, and that's okay, right? You're going to have about 10 minutes to discuss. And again, there's no need for perfection here. So Danielle is going to put the document in the box, and I want to answer any questions you have about implementation science, why we're focusing on stakeholder engagement and collaboration. Any questions that came up while I was talking. You can unmute yourself.
Hey, Caitlin, it's Pam.
Yes.
Is Danielle going to break some of the larger groups into 2? You may have said that. I got kicked off with my internet went down and I had to come sign back in. You may have said that while I was missing, but just thought I'd point that out.
Yep, I actually think I have everyone covered as far as their communities. I've been cross-checking our registration list. So if you haven't yet put your name, your community in your name, no worries. I think I've got you. There may be a few left in this main session that I can, once we, I'll ask you which community and then I'll shoot you over to your correct group. And if I put you in the wrong group, please come back to the main session and I'll redirect you as well. But I did break up some of our larger communities into 2 groups, so you should have a nice size group to have a conversation with. And I hope everyone can see the file that I dropped in the chat. You should be able to download it. Is it there? Oh, we don't see it.
Yes, it's there, and I was able to pull it up out of the box, so it's working.
I don't see it.
No, I can't see it either.
Well, here's a link.
I can't see it either, yeah.
Okay. This is a link to the document where it lives.
It's there now.
See that?
Yep.
So please remember, this is a document that could take you months to complete, right? This is just to stimulate discussion. Please focus wherever, the focus is for your group. There's no perfection needed.
So I will go ahead and open the rooms. So jump back in if I don't have you in the right room, okay?
All right, enjoy your discussions, everyone. Welcome back, everyone. Hope you had some good discussion. Welcome back. It's great to see everyone's faces. Hope you had rich discussion. I think we're all back now. And what I want us to do as we're building in workforce wellness into the conference, I'd love for you all to take a break. And while you're taking a break, either before or after, just type in the chat something you took away from your discussion, something that was surprising or meaningful, or something exciting that you all talked about. Right, so I'd love for you to include that in the chat, but please take a good 5-minute break. Mebin, that means we'll probably get started around 1:20 or so, and we'll have your slides up for you. So feel free to take a break, everyone. As you reflect on your activity, please put some reflections in the chat, what you're excited about, what you're hopeful for, and we'll see you in a bit.
I have that we are on time. I'm looking to see if I see Danielle's face to give me the go ahead. Am I good? Yes.
You are good to go.
Okay. Well, welcome back from your break. Sorry it was short and sweet, but we've got more great information to hear. And so I have the privilege, Danielle, slide me forward, of introducing New Hanover. So we're going to spotlight or highlight, if you will, the New Hanover Resiliency Task Force today. When you get a copy of the slide deck, you'll see a little bit of the history of the task force. I put it from their website on this slide. But I'm not going to take the time to read through it today since we're running just a few minutes late and I don't want to take any of their time. But I'm delighted to have presenting from New Hanover, the director of the Resiliency Task Force, Mebane Boyd, and the very honorable Judge Jay Corpening, who is one of the steering committee members. So Mebane, I'm going to let you take it over from here.
Okay, so I'm going to try, is Danielle going to pull up the PowerPoint or am I going to share my screen?
You are welcome to share your screen.
Okay, let me
know if you can. I paused mine, but I may need to stop it so you can start.
Telling me I can't share while you are sharing.
All right, so I'll stop. There we go.
Okay. That working? Can you all see that?
Do not see your presentation.
All right, let me try that again. How about now?
Yes.
Okay. All right, Judge, I'm going to have you start us off.
Okay, so we're thrilled to be with you, Mebane. If you can go ahead and go to the next slide. We're going to talk to you about sort of our journey up to this point, from how we got started and the steps that we took, especially in the beginning, to make sure that we enabled ourselves and empowered ourselves both to be successful in the long term, on up to the current day where Mebane will share some of your successes. So these are the 6 things we're going to cover today. I'm going to talk about getting the team to the table, defining the problem, and then defining outcomes and goals, which will actually share our excuse me, our mission and vision with you. And then Mebane will talk about defining the process and methodology, creating a culture, defining the role of the task force, and then measuring outcomes, because measuring outcomes is so incredibly important, but also we've learned so incredibly challenging as well. So if you go to the next slide, please, Mebane. So it is critical to build a foundation. When you start this work and as you're progressing along your journey, if you don't take care to build a solid foundation, then your work will crumble later. And I've included some pictures of our new juvenile building in New Hanover County as an illustration of this, because before we dug the first hole in the ground, we spent 18 months in planning. 18 months. You know, you start a project and you get excited about it. You say, yeah, let's go, let's do it. But there's a process called plan, mobilize, and deliver that is important to follow as you do your work. So 18 months before we dug in the dirt, and then we poured thousands of yards of concrete. You know, what you're seeing is some of the concrete footings, and after they poured all these massive concrete footings, then we had an entire slab poured over that. And then the steel starts to go up to create the structure, right? And only then, after we've got the solid foundation and the steel infrastructure, does the brick go on and the glass to then give us the beautiful building that we're going to move into in February. Without that process, then it would not be sustainable. It would not be enduring. It would not last for the time that we need it to last. And the same is true for your task forces in your communities. It has certainly been true for ours. We spent a lot of time at the outset doing this work. Next slide, Mebane. So the first step is to get a team to the table, and that's the start of building your foundation. It is important to work across sectors, to involve key community leaders. This is a photo from when we were together live in Chapel Hill, actually. for training. And this was the team that we had in Chapel Hill. But we've involved our district attorney in this process, and we've involved leadership from our school system, from across our system. And in fact, when we were in our breakout just a few minutes ago, our conversation focused on who's missing. We're 3 years into this, but who's missing? Who else do we need? What other organizations, providers, who else do we need to include? Don't wait for everybody to be at the table to get started. You will still be sitting around a year from now waiting for everybody to say it's convenient for me to meet. Don't wait. Gather a key group and get started, and then let your work draw others to the task. I think that's incredibly important, because what we've seen in our community is that more and more people want to be involved and get involved, and we've got a whole lot more people involved now than when we started, and it's because we've grown the work. We started building that foundation, and we've grown the work, and that's critically important. Next slide, Megan. So we've got a steering committee that is the foundation of our work. That we do a lot of the planning, and then we deliver information and ideas to the task force at large. But you can see that this group is a pretty diverse group and includes leadership from a variety of systems. The fact that we've got a city councilman participating, who is also a respected member of the clergy in our community. Bodine, who's with us in our meeting today, is a senior HR person with New Hanover County. Beth Schrader, who is the resilience director for New Hanover County, is a strategic planner by trade, and is an incredible strategic thinker. And that's what brought her to our table. And it was only through the development of our task force that New Hanover County moved to focus on resilience, and Mevin's going to talk more about that, and then ultimately created a position called Resilience Director for our county. Kristen Jackson, Director of Student Support Services in New Hanover County. Kim Heck, who's with us on the call today, System of Care Coordinator for Trillium. We're across systems and together as a steering committee, and then that's representative of our group at large as well. And I don't mean to leave people out who I can't see on my screen who might be here from New Hanover County, because we just had a small group in our breakout group, but this is a very active steering committee that meets monthly. Next slide, Mevin. So it's important as a group that you create group understanding, that you create your own culture. And there's some important parts of that, because we have revisited the idea of safe space recently, even in our group. The space has to be safe for everyone. Everyone has to feel valued. Everyone has to feel respected. It is critical you create that culture. And so part of that is that in these, I'll call them idea bars, and I'm going to move you guys to the other side of my screen. We recognize and respect the different needs and strengths of the folks that are participating with us. If we're coming together across systems, then we've got lots of differences. We'll find commonalities, but we have lots of differences, and we have to respect that among each of us. We have got to listen to understand. I think it was Stephen Covey that said, seek first to understand and then be understood. So we have to listen to understand. And I'm particularly sensitive to this, because as much as I enjoy talking like this, and I love doing this, I listen for a living. So we've got to listen to understand. And if I walked into a courtroom and all I did was talk, and nobody else talked, we got a disaster in the making. And people would leave absolutely determined that they had been wronged, and they would have been wrong because they would not have been heard. And one of the ways that we remind people to listen to understand is the next idea bar, where we step up, we're involved, but we step back and wait. But wait has a meaning. It means, why am I talking? And so wait is a reminder that it's maybe an opportunity for other folks to talk, and to be able to step up and share their ideas and to listen and to seek to understand. We also realize that we need to welcome dissent to strengthen the final decision, and we've been having some experience with that because we're looking at issues of race equity in our community as well, and the connection between racial equity and law enforcement, and we're starting to have some challenging conversations that are important conversations, and everybody doesn't agree, and so we have to welcome dissent which will guide us to a stronger final outcome, and then work towards consensus. Consensus is a powerful word. I'm lucky enough to be in leadership at some committees at the state level that, either working on the coronavirus response of our court system or reforms in juvenile justice. And, we take votes in those groups, but we don't vote until we've got consensus. The vote is really just a formality. Consensus is bringing everybody along to the path that you're on, making sure that everybody's on board, fully understands what you're doing, and can move forward together in your work. Because 51% of the vote still is divided, right? We're seeing that play out right now in the United States. We've got a close outcome in the presidential election with folks on both sides saying, we're right, and it's not unified at this point. So work towards consensus, and then provide opportunities to promote resilience within the group. We've also recognized that need, that there are times when members in our group may need some assistance or some opportunities for some grounding, some reconnection. And it's important to pay attention to that as you take the journey, especially as you tackle hard issues. Next slide, Mevin. So identifying the problem is the second step, and and this is stuff that all of you guys have seen. Of course, when I remember when we first watched the movie Resilience, when we were talking about the ACEs study, well, then we started in our work, and then we were dealing with a pair of ACEs, and now we're at 3 realms of ACEs, but we use all that to define our work, and this was particularly important to us, and remains important now. And the realms of ACEs comes from ACEs Connection, the 3 realms of ACEs. Saw somebody that liked that. So the tree represents the ACEs study, those factors. Thank you, Mevin. But then we found that there was trauma in our community that was affecting people, and you can make a list for your own community about what's in the community environment that creates trauma, that are every bit as real as the historical ACEs from the ACEs study. But then for us, Hurricane Florence came along and hammered our community. I'm still out of my Pender County courthouse. Over 2 years later, I'm not back in because of damage that was done. Damage in our community that still hasn't been repaired. Trauma, personal trauma that people experience, whether they were providers or citizens. So we begin to recognize that environment could be a source of trauma, the same as others. And now let's add a pandemic to it, shall we? Because this pandemic has caused trauma like nothing we've ever experienced, and the isolation that this has brought, folks not being able to be around, think about the conversations about Thanksgiving coming up. folks making hard decisions about not being with family and the experience. So it's important to look at the 3 realms of ACEs as you work, and then to let that be part of what guides you in your work. Next slide, Nevin. So we did the needs assessment with you, back to 2019 feels like it was 5 years ago, because 2020 feels so long, right? But so the majority of the respondents to our needs assessment said that their agency would benefit from being more trauma informed, and that really wasn't a surprise. It was 83.2% of folks. But then flip to trauma informed practice, and less than half of our respondents, 44%, indicated that they believe their agency currently has policies and procedures in place to reduce practices that may increase the children's trauma symptoms. You see the difference, and therein lies our target, our work, right? Because we've got, everybody agrees that we ought to be more trauma informed, but then we hadn't done a lot of work to become more trauma informed as agencies or individuals. Next slide, Nevin. So we set some goals, and these goals came from that same needs assessment. So there's a reason that we were asked to do that needs assessment. So let's put it to work, right? We use risk and needs assessments in our juvenile court world, our delinquent world, to guide everything we do, including funding for JCPC programs. I mean, we use that data. And so these are the 5 top goals that we set based on our assessment. Every single one is important, and I think that there's some logical progression in these goals. But these are the 5 that we identified, and so we would encourage you to look at your assessment and then make your decision about what your goals need to be. Yours may be different than ours, but these are the 5 that we set. And one of our, I'll share that one of our struggles is the moving from awareness to action. We've done a fabulous job, and Nevin will probably talk more about this later, about educating people and about heightening awareness. But then some of our struggle is, we know that we heighten awareness, but what do we actually do as a task force? What are our action steps other than educating the community? What do we do? And then an important piece for us has been addressing workforce stress. And Mevin's going to talk about a New Hanover County initiative that's designed to help with that. But we realized, particularly in the wake of Hurricane Florence, that we had to take care of the providers. We had to make sure that our providers were resilient, because if our providers are not resilient, our first responders, our healthcare workers, our social workers, they weren't resilient, then who's going to take care of people? And so we felt that was important. Next slide, please. So the last thing I'll share with you is our mission and our vision. And we have come a long ways from the first day that we gathered personally in an office over in the Harrelson Center in Wilmington to do our first draft of our mission and vision statement. But this is where we are today. I think it's one of my messages to you today would be that this may evolve. Your first draft that you agree on and approve may not be your last. And so for us, our mission is to build our community's resiliency. We work to reduce and prevent ACEs or trauma, respond to existing trauma in children, adults, and providers with knowledge, empathy, and compassion, and create opportunities for our community to form meaningful connections with one another. That's our mission. That's a long sentence. Our education folks that participate didn't criticize us about the length of that. Our vision is a little both simpler and more complicated at once. New Hanover County is a compassionate and resilient community, and we believe that we can be. We believe that we can be, and we're in it for the long road to try to make sure that we are. So those are the first 3 steps of our process. And Nevin, I'm going to hand it off to you and look forward to hearing what you have to say about the last 3 steps that were covered today.
Great. Thank you so much, Judge Corpening. And when the first slide was up about convening your team, key steps to getting started, get a team to the table. I do just want to thank those of you on the call today, many of whom were at that first table. But Judge Corpening in particular, people wanted to know in the beginning, often they would say, well, is Judge Corpening going to be there? And when I would say yes, they would show up. And I think that you've played such a great role in getting people to the table and showing up. And I'm just really grateful, not just for today, but for the whole 2.5 years we've been working. So in terms of the defining the process and methodology, the way our group works is primarily through subcommittees, and you'll see the committees on here. Each of them has their own personality, their own way they work, and you'll see marketing isn't working right now. We've had a hard time getting that one up and running, but we've got a placeholder for that. And I did have a conversation with Kia 2 or 3 months ago, and she told me what her committees were going to be, and I thought, oh, those are really good. That's a great way to organize. So as Judge Corpening said, I think this is sort of a moving target that you're always honing and figuring out what's the best way for your community to work. This is a graph of how we're organized. And since we did this presentation in April of 2019, I think, or September, I can't remember, we've added an arts committee, which is really active and looking at arts as a way of healing. And they've got a tremendous sense of energy and what they want to do in the community. And that's been fun to watch develop. One thing that's a little different for us than from some of the other communities might be our involvement with the National Center for Disaster Preparedness. They have, and there is a New Hanover Disaster Coalition as a product that came out of Hurricane Florence and taking care of children's needs. We ended up chairing that committee. So we've got two pots that we're working in, but the light blue colors are places where we're getting some significant advice and help, and that's been really fun to work with. And defining the role of the task force, about 3 months ago, we had a steering committee meeting, and I got the question from a couple, I think it was Beth Schrader, who said, I don't even know what we do. And at first I was a little bit taken aback by that comment. Like, of course you know what we do. We've been doing it for 2.5 years. But actually, it made me sort of go back and put pen to paper and to come up with some ideas to bring back to the steering committee to really define who we were. And again, when Jay was talking, or I should say Judge Corpening was talking about the group understanding on that slide about welcoming dissent or welcoming ideas even when you don't agree, that for me, that was a real eye-opener that, yes, that was a really good exercise for us to re-examine. What does the Resiliency Task Force do? And there is a difference between what we do and what we influence. And I'm going to show a slide in a minute about that. But the amount of time we spend, just like those slides at the beginning with the foundation, creating the roadmap, going back to square one, let's rewrite our mission and vision statement. Let's look at our plan again. That rather than feeling like that's getting in the way of the work, it actually is the work, and it will change. You'll have lots of iterations of that. So this is where we landed on what does the Resiliency Task Force do, and we divided it up into 3 main areas. One of them is to prevent ACEs. And as was presented, that we're not just talking about adverse childhood experiences, but also adverse community environments. We can't prevent adverse climate events other than to advocate for working against climate change. But those first 2 definitely we want to work on. And then number 2, to respond to existing trauma with knowledge, empathy, and compassion. And finally, to create opportunities for residents and organizations to form meaningful, healthy connections. And if you'll see, those 3 things showed up in our mission and vision statements. Things are lining up a little bit better now than when we first started working. So here's some things, dividing up what have we done versus what have we influenced. Some of our things that we've directly done through grant support and through support from the Duke Center for Child and Family Health, we've done CREM trainings, R4R trainings, and lots of trainings we've brought to the community. And like probably many of you on the call today, we've done resilience movie screenings. We've provided safe places to gather and break down those silos and facilitate dialogue. And we've done lots and lots and lots of planning. And out of that, you'll see what we've influenced. We, New Hanover County government had a mandatory training in the last fiscal year for all its staff. That's 1,800 people. Bodine is on the call today, was instrumental in making this happen, and it's a real win for our community. We also, communities in schools, brought Freedom School to New Hanover County for the first time in 2020. And even with COVID, they were able to hold that school safely to about 50 kids, 2nd grade to 8th grade. A lot of grant investments around trauma and resilience have been brought into the community. Coastal Horizons had won over $2 million to do more resilience education having to do with Hurricane Florence response. Our emergency management has provided improvements in their sheltering for children. And there are currently 10 trauma-sensitive pilot schools. There are other things, but these are some of the highlights. And what I'm going to do, I'm just going to show this for 10 seconds. This was our first iteration of our plan. This was the 2nd one. This was the 3rd one. And this is the 4th one. This is our action plan that actually we're going to be presenting to the task force at large tomorrow morning at 9 o'clock. Looking for folks to sign on to become part of this action plan. And I wanted to go through this quickly so that we didn't dwell on them, because I think, and I'm happy to share those, but I think it needs to be individual communities that come up with their own plan, because that's how we've created the relationships we need. That's part of like the pouring concrete for the new judicial building. That's part of the pouring the concrete. It's part of having hard discussions. It's part of getting frustrated that things are taking so long, because actually this work is going to take a generation. If we do our job really well, we'll make a change in a generation, which is 25 years. So I just wanted to go through those quickly to really emphasize, number one, that they'll change, that you just sort of stick with it. And number two, that it's the work. And then finally, number 6, this is hard to measure the outcomes. How do we know that we're measuring the right thing? And because I think this is new, not just in North Carolina, but across the country and across the world, working on resilience in trauma-sensitive, trauma-informed communities, I don't think we know yet. We do know that we are measuring some of our outputs, things that we're actually doing, rather than outcomes, things that will happen because of the work that we're doing. So for example, this is a new graph over time of the trainings that we've done for community resilience model and Reconnect for Resilience and coaching. And you'll see we had a real drop off, March, April. What do we do in the world of COVID? And we are swinging back up again, but it took us a while to find our feet and to figure out, you know, how do we proceed? How do we keep moving? But a graph like this can tell you how little coaching we're doing. And it can tell you that we are doing a little bit more Reconnect for Resilience than we're doing CREM trainings. This would be an example of an output rather than an outcome, because we can't prove that anything has changed, but it just shows what we're doing. So I'm gonna skip this one because we're about out of time, but these are the ACEs connection milestone trackers that we are working towards measuring also as outputs, not outcomes. So here's some highlights. This is, somebody said, what has the Resiliency Task Force done over the last 2.5 years? We have trained almost 4,000 people, and trained is a very generous word. Some of those might be really light touches, like 30 minutes to an hour of CREM introduction, but we still want to count that. We also have done some, we call them OPP, Organizational Partner Profile Assessments, to 43 organizations that have signed on to say, hey, we'll give you data about what our organization is doing around becoming trauma informed. We created a website. We have been selected as a CAN, a Community Action Network, through NC Child, where we are working on that second ACE, the adverse community environments. If we can advocate and become involved with holding our legislators accountable for, or helping them understand the need for trauma-informed systems, we can move a lot more needles. We're holding conversations that are really hard between the community and law enforcement, especially around issues of racial equity. And we're kicking off our action plan tomorrow, actually. And then we also created a Facebook group specifically focused on educating against racism. So this is the final slide. So key learnings, including as many people in decision-making as possible to get buy-in. And in our breakout group, I was like, we have got to get families and youth to the table. That was a real eye-opener for me today. So thank you, Center for Child and Family Health, for bringing that very clearly to our attention. Invite, who isn't here and why? And Judge Corpening talked about this, being willing to listen. And if you hear something, be willing to change course, be willing to get back to your plans and say, well, we've heard this a lot. How can we incorporate what we've learned, what we're learning now into our planning? And say yes, as often as you can. But for those of you who are coordinating this, I just have this warning that as long as as you're not just saying, as long as people aren't saying, you could do blah, blah, blah. You could do this, you could do that. I mean, that's really easy. But those of us who are in leadership roles with this need to be able to say, how are we going to do that? Because the coordinators are not going to be able to do everything that needs to happen. So create a safe environment within the task force. This can be challenging. We have had to work on that. And recognize that planning and conversation is the work. It's not getting in the way of the work. So that's it. I hope I stayed on time.
You did perfect. Danielle, I'll let you take control of the screen as we go back. Does anybody have any questions for Mebane or Judge Corpening?
Could I say something to just
Sure, Kia.
celebrate Mebane and how extraordinarily generous she's been with her time and wisdom in helping us, just answering questions and like, how do we do this? I'm just thankful to her and want to celebrate her for a moment.
Well, thanks, Kia.
Yes, I agree. I see in the chat someone has written, this has been very motivating and inspiring. I would agree. Would agree totally. Yes, I think I learned about as much from New Hanover every time I go to take some information and to gift y'all. I come away feeling like, wow, I have learned something from y'all as well. So it's a pleasure to partner with y'all. I put this slide up for us to have just as we kind of went through the questions and any kind of thoughts that came up from their presentation, but it just shows some of the different partners that they have at the task force within their community. And I thought that was a good way for you to see a good visual of stakeholders, being able to get the different organizations to come to the table. So thank you both. Angela, I think I'm throwing it to you next.
You are. And I'm telling you, well, first of all, thank you for that wonderful presentation. And it fits so well with what we're talking about today. And I think what communities want to hear more about is the journey that you all took. And I think one of the best quotes that you all said was the process is the work. That is the work. Being able to learn from and adapt and listen to communities. And I'm with you all in the chat too. This is great and a tough act to follow. And I'm the following act, so think how I feel. But it was wonderful. Thank you both for presenting today. We're gonna do a pretty applied activity in this next section. And I'm gonna run through my next slides pretty quickly so you all can have some team time to talk about these concepts. But we're gonna talk about getting a team to the table and engaging and partnering with inclusive, keyword inclusive, stakeholders and community members. We can go to the next slide, Danielle. Thank you. So I want you all to have some questions in mind while you're having this discussion, just in the back of your mind, thinking about, and some folks have already said this, who is currently at the table, more importantly, who is not. So looking around your table, who is not represented there? Our racially and ethnically diverse populations are presented. What about intersecting identities? I think Bo is mentioning LGBTQIA partners and other intersecting identities. Are there voices from the communities we serve at the table? Who knows about your community's trauma-informed practices and who doesn't? How do you reach key partnerships and stakeholders? And then of course, we can't not talk about the impact of COVID. So how has COVID provided barriers to and opportunities for partnerships? Like right now, we get to see all of you all through Zoom, where we didn't have to travel. Although I'd much rather be in person. I'd much rather see all of you in person. All right, let's go to the next slide. Thank you. Also some terms to consider while we're discussing disproportionality and disparities. So I want us to think with that lens on. Just for our clarity, I'm going to go through both definitions of these. So disproportionality, the underrepresentation or overrepresentation of a racial or ethnic group compared to its percentage in the total population. So thinking about where is our reach, who is making the decisions, who is at that leadership table. Disparities, the unequal outcomes of one racial or ethnic group compared to outcomes for another racial ethnic group. So who are we reaching? Who is getting the services? Who are not getting the services? So when we're saying who we're actually reaching, I also want you to think who we're not. Okay, let's go to the next slide. This is one framework that I found that I thought was really useful. And what we're going to do is have you all break out in communities and work through this framework together. So it's the Framework for Race, Equity, and Inclusion Action Guide from the Annie Casey Foundation. It's online, it's free. It breaks really complex components up to 7 steps. And at first when I read this, I was like, 7 steps for this sort of work. And then I realized each step is so intensive, it would take a long time. So I felt better about the 7 steps thing. All right, we can go to the next slide. And this is just a picture from the actual guide. And then we can go to the next one too, Danielle. Thank you. So I'm gonna run through these. You all are gonna see these later in a document. So these 7 steps, step 1 is understanding of race, equity, and inclusion principles, and looking at your partnerships with communities and service systems. And I think our presentation beforehand, before this one, really focused on that. Partner with communities, partner, 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 and make sure folks have this understanding of the impact of systemic and structural racism, the understanding of race, equity, and inclusion and the importance of that. And are folks getting trainings to increase awareness of this in service system? Is this part of your language? Are you talking about this at the table? Step 2 is engaging impacted populations and stakeholders. So partnering with stakeholders connected to the community. And when I say partner, I mean they are active in leadership, decision-making, power, and ownership. So 2 things I think about is partnering and sharing power, making sure we're coming together and the decision-making is equitable and equal. Okay, gather and analyze disaggregated data. So data is needed for sure. And I love the roadmap because I saw data across the roadmap, which is good because data can inform decisions, right? And I know I was trained in such a way that we look at aggregate data a whole lot, right? We put it all together and we look at it. This is suggesting, and I totally agree, let's disaggregate this data, break it up by race, break it up by gender, break it up by other groups. See how these things break out. Are we reaching this group the same as we're reaching this group? Looking at disparities and disproportionalities. So breaking up that data. Okay, can go to the next one. Oh, bye Keith. So step 4 is conducting a systems analysis of root causes of inequity. No small task. There's a systems analysis guide on the side here that you can read that has some really great questions to talk about the different inequities that do exist. This will mean diving into your policies and practices that may reinforce inequities, coming at that with a lens of how am I reinforcing these inequities that do exist? One way to do this is through a systems analysis, and that's an example right here. And you can find it in the actual document. I think Caitlin put a link to it on there. So, okay, step 5 is identifying strategies and target resources to address root causes of inequities with community partnerships. And you'll see an example on the next slide of the questions that facilitate that discussion, but it's generating those solutions to root causes with the community. So with the impacted community, making sure they have a voice at the table and power in decision-making and target efforts to address disparities. And also something that was pointed out in the presentation before is listening, really listening to our communities. What has worked for them? We have a lot to learn. Okay, can go to the next slide. Step 6 is conducting the equity impact assessment for policies and decision-making. So really, this is before anything is done, right? So we're going to look at this before anything is done, predict the impact of new policies. How will I know? How will we know if this is successful? What's our plan to see if this is successful? And predict how this will impact inequities amongst groups. And you can see on the side here, this goes along with step 5, but these are some of the questions to develop racially equitable solutions. And there's a number of different questions. These are just examples. And then step 7 is continuous evaluation. And that was also highlighted in the presentation before, which I was like, this is so great, I can tie it in. Continuous evaluation of effectiveness and adapt strategies. So continue to invest resources to combat inequities and promote policy change. Continue to assess, continue to talk about it. That process is the work. And see if those goals have been met, and then adapt, change course if needed. And we saw in the different roadmaps and different plans that Mebin showed how those things were adapted over time with data, with information. So that was wonderful. All right. Let's go to the next one. Okay, so we're going to go into our breakout groups, and we're going to include these instructions in the chat. But if you want to, I know I do this, is take a screenshot of this screen right now. Leave me out of the picture, please. Take a screenshot of the screen. You're going to receive a link to a Google Doc in the chat box. And so you're going to click on that. Thank you, Danielle. That's perfect. And so you're going to click on that link, and it should bring up a spreadsheet. At the bottom of the spreadsheet, you're going to see your communities tab. So you'll see New Hanover, Pitt, Caldwell, and you're going to see your community tab. Only open yours. So each community is going to be doing their own work. So we want to respect other people's privacy, but open your tab. And then you'll see there's the 7 steps that we just reviewed, and there's a definition in there, so you all won't have to worry about remembering it. And then you're going to rank yourself of where you are as a community or where you think you are on that step, and just jot down some notes about what you've done in those key areas and where there's room to grow, because there's always room to grow. And then we'll be able to keep that data and share it with you all as well. So we'll be able to give that back and facilitate, I think, some really interesting conversations. So anything I'm forgetting, Danielle?
I think you got it.
Okay, in 10 minutes, I did it. Okay, and we'll have about 20 minutes in our breakout rooms. We wanted to give you all a longer time with this. And again, I also want to say there is no expectation to finish. If you get through one step, great. If you get through none and have a great conversation, great. Wherever your team and community is right now is what we want. So use the time as you will. Great. Okay, so I'm looking at the time, and I know I zoomed through those slides, and I'm hopeful that you all had some rich discussions there. And again, it is not expected that you were to even complete it or finish it or start it. It's just there for you. We'll share it back with you to be able to take to your own communities and work through it. This is one of those tasks that takes a lot of digesting, a lot of processing, and a lot of really hard introspective work and a lot of brave work. So I want to express my gratitude for you all being very willing to do this brave work and taking a look at who's at the table and who may not be. Okay, so we can go on to our next, and I think Pam, I'm tossing it back to you.
There you go. We're batoning back and forth. So,
I know.
So I popped into a group and just eavesdropped on your conversation, and it was great. So y'all are doing some super work. We're really excited to be able to continue working with you all. So I'm going to spend a few minutes talking about crafting your message and measuring your reach. Danielle, move us forward one. So I want to talk a little bit about the elevator pitch. And I went online trying to figure out, where did this idea even come from? And the best idea that I've found that they've been able to kind of connect and piece back, and it really makes sense to you, what I'm going to say, was the story that I found regarding a pitch that some journalists would do with the editor-in-chief of Vanity Fair. So she never had time to devote and schedule these journalists to come in and sit down and let them pitch some ideas to her. But they found that if they would hop on the elevator when she got in on the ground floor or when she got off on her floor and take the elevator down, they would have a few minutes of undevoted time. It's kind of like when I worked with kiddos. I used to love to drive on places because they were a captured audience. And that's kind of what happened inside this elevator pitch. These journalists had this editor-in-chief at their attention, and they had to pitch an idea to her about the ideas that they wanted to run that were so imaginative that she'd want to bite and immediately say, yes, go for it, write that story. And so I want to talk to you about coming up with an elevator pitch for your resiliency task force. So the pitch is a brief speech designed to help you communicate effectively in a very short period of time, anywhere from 30 seconds to about 2 minutes tops. And the goal is to make such an impact, such an immediate impact, that the listener is enticed. They want to know more and more about your topic. Danielle, slide us forward. I saw this quote by an American journalist, an American author, and he's known for marketeering, Seth Godin. And he said, the purpose of an elevator pitch is to describe a situation or solution so compelling that the person you're with wants to hear more even after this elevator ride is over. That's kind of what we want you guys to come up with. And there should be 4 key components to your pitch. Okay, so a good pitch will offer these 4 parts. The context. This is the actual work that you're doing. So it's trying to tell them in a very short, brief period of time, the work that you're doing. The hook. You want to get them and bring them in. This is why your work is so important. The solution, what we have achieved to this point. And then the ask, we need you to join our movement. These are the 4 key components, and special thanks to Jennifer Agosti, who helped create and come up with the information here that we wanted to include on this slide. So I'm going to give you kind of a little bit of an example. So it might be, I see my good friend Kia out there today, so I might say, hey Kia, it's great to see you. I want to take a minute of your time and speak to you just a little bit about the North Carolina Trauma-Informed Communities Project. Our goal is to spread trauma-informed knowledge into our grant communities. It's important because childhood trauma is a serious issue facing our nation. In an effort to be prepared to be more helpful to these kiddos, our communities have got to become more trauma-informed. So following a needs assessment to determine the individual county needs, the TIC project offered several trainings designed to infiltrate basic trauma knowledge into our community. More recently, the project has shifted the focus to pay special attention on growth and sustainability of the resiliency teams in our community. Doing the child and family work that you do, I believe you would be a key stakeholder in our resiliency team. We meet monthly, and I'd love the opportunity to gift you with an invitation to join our efforts to create an enhanced and more compassionate trauma-informed community. Does that sound like something you'd be interested in? Elevator doors open, and Kia says yes. And so then I would want to make sure I followed up and got some more information to her. It sounds like it should be. I mean, when you look, oh, context, hook, solution, the ask, it's not that difficult, just as a matter of sitting down and crafting your message. Danielle, slide me forward one. So for your pitch to be successful, it needs to be informative. Again, you got to remember, you got to get all that information in just a little itty bitty time. It needs to be persuasive, and it has got to spark some curiosity. You've got to get their taste buds wet a little bit and want to know more. It needs to be positive. You can't go up to them, oh gosh, I just came from that resiliency task force meeting. Let me tell you, phew, boy, work, work, work. Can't be that way at all. It needs to be brief and concise and impactful. It needs to be merit-based, goal-oriented, and relationship building. All of those, if you have those components, your pitch will be very positive, and you'll be able to hook in some of those stakeholders that we've been looking for that perhaps you haven't had available to you. Danielle, slide us forward one slide. So we're going to give you not long. Sorry, I know we've done bad about not giving you long enough, but we want you to go into breakout rooms one more time. Danielle, you're the master of the breakout rooms today, and we want your teams to try to work to come up with an elevator pitch. Once you have an elevator pitch, then you can send it out to individuals in a way that individuals will probably want to tailor the pitch to make it fit their personalities, if you kind of know what I mean there. But it needs to be the same messaging. Same messaging needs to be going out, even when you have your own little personal spins to it. And then in addition to having your own personal elevator speech that you can move forward with, then you can take this elevator speech that you work with and come up with as a team and see how you can go about pitching this to other stakeholders through social media and other places that you might could reach other people. Again, the whole goal is to help us find some missing stakeholders and get them into our partnership so that they're all working with us. So Danielle, if you can break us out, back up. Before you do, Danielle, can you back up just a couple of, I should have told everybody to take a picture. Back up to my there you go, 4 components. Y'all take a picture of that with your phone so that you'll have it when you get into your breakout rooms, and then you'll remember the context, the hook, the solution, and the ask. And Danielle, if you'll give them about 5 minutes and then bring us back, I guess.
Now, I think we've got everybody back from the breakout.
And slide me forward a few slides.
Rod was in mid-sentence of some really great wording. So Rod, would you do me a favor and email that to us? And then we can go on with it.
I can't see Rod's face, but I'm sure he will do that. He's a great gentleman. So to kind of pull together and pull all of our ideas here with regard to the elevator pitch and measuring your reach, let's kind of close out with a little bit of this. And we realize we only gave you just a taste of kind of where we want you to go with this. But we're trying to give you some ideas of some conversations to have once you get back into your resiliency task force community team meetings. And so taking some of these ideas and pitching them as conversations to continue, if you will, in your resiliency task force. So how will you know when your ideas and your strategies have been successful? How will you measure your reach? Well, what we would recommend that you do is ask, once you come up with this elevator pitch, then ask current members to share the pitch. And the first thing we would really recommend is that it's easier a lot of times for us to do something that we've never done before if we're doing it with a friend. That's why I was able to say, "Hi, Kia," as we were getting on the elevator. So pitch your elevator speech to a friend or a colleague that you believe would be a good asset to your task force. Okay, so reaching out. Then we ask that you go to the next step. So then try to find an individual, perhaps somebody from another service system that you may have attended a child and family team meeting with, or just someone that you've identified, but try to think of those stakeholders who are missing from your task force. Oh man, it would be great if we had a child welfare social worker attend this meeting. Well, then pitch it to that team, pitch it to that service system, and see if you can't get some feedback there. Then lastly, the third step is we want you to pitch the idea on social media platforms. So if your resiliency task force has a social media account, pitch your elevator speeches there and see who all you can reach. And then as you have new members come in, follow up with them after 1 month, after 3 months, after 6 months, followed up and find out who has joined and who is still missing. So you've constantly got to be looking over that, going through that data. Follow up with the new members. Ask how they heard about your task force. If you find that the elevator pitch messaging has been successful, then great, continue those efforts. If you hadn't, you may need to tweak your message a little bit. But you may also need to be reaching out to additional people. So there's a couple of steps then you've got to figure out. Who is still missing from the table? Who do we still need to reach? Who do we still need to make sure that we're trying our best to connect with? It's a whole lot about connectivity there. So that's measuring your reach with regard to your elevator speech. I think I'm passing off to Angela, but it may be Caitlin, I'm not sure.
I think it's both of us. We just
okay.
keep back and forth hands. So I'm looking at the participant list, and there is 55 of you hanging in there for these 3 hours together, and I just so appreciate it. And again, this time was meant to start talking about, to start those conversations that you will take back to your communities and see where it fits with you all. So let's talk about some next steps and wrapping up for today. You can go to the next slide. All right, if you all have not seen this, we're very proud of it. It's our new website, and it's the Trauma Informed Communities Project, and you can see the link right here. It really is a hub for our counties in this project, so everyone here. So if you go there, you'll see upcoming events, which was today, and we have some more coming up. The resources tab, I really want to send you all there as well, because I don't know about you, but I feel inundated with resources sometimes, where I'm on all these listservs that come out with all these new fact sheets, and so sometimes it's really overwhelming. So what we did was the faculty on this team went through all of these resources and said, well, this one would be really good for mental health. This one is really aimed for juvenile justice. This one is aimed for schools. So we broke up a lot of resources across different platforms and different agencies and put them into these categories. So we have mental health, child welfare, schools, juvenile justice, courts, medical. We have a section for intersecting identities, and we have a section for parents and families. I think I covered them all. But you'll see each section and you can click on it and it'll drop down resources. We're trying to keep it as up to date as possible. And so as new resources come out, we're trying to plop them into these categories. And so check back on that often. We also have our COVID-19 series of training. So you all can see us talking about workforce wellness and really focusing in on different inclusive strategies of what wellness does mean and how we can define that better for folks in the workforce. And we also have a previous talk that some of you were on when the pandemic was first upon us, talking about the impact of COVID-19 on the communities that we work with. So please go there and take a look. There's a lot of things there for you all. I think that's Caitlin, right? I can't see you, Caitlin, if you're...
I'm happy to talk about it. So we've put the plug in a bit for the community needs reassessment and its dissemination. So you've heard it throughout the presentation and conference today. And we also know that New Hanover has really used some of the needs assessment results to drive their goals, their mission and vision. And so that's how we really hope that this is going to be used within all of your communities. So we will be sending out the survey link to the needs reassessment. We'll be sending it out to the community team team and service system leaders, please keep an eye on your email and inboxes. So you should be getting a message either from Sarah or Pam with that link. And we want you to consult with your faculty member to discuss dissemination plans. We're here to help and brainstorm how to reach all those stakeholders in service systems. You've all done this before, so you can think about what's worked well in the past and what you want to replicate and what sort of tweaks you want to make. We're hoping that all responses can be completed by Friday, December 18th, before the holiday season really sets in. If this is absolutely impossible, just let us know and we can do a little bit of shifting, but we're aiming for Friday, December 18th, so we can run those analyses for you and help develop a technical assistance plan. We will be presenting the results in January and early February 2020. And then we're hoping to have those technical assistance plans, basically plans to help you support your next steps and plan for next steps on Friday, January 29th of 2021. Those are our exciting next steps. Want to go to the next slide, Danielle? So this is our contact information. As always, please reach out. Let us know if you have questions, concerns, ideas. And in order to gain your feedback, right, and learn more about what this conference was like for you, we also have a follow-up evaluation. Danielle is going to be, she put it in the chat already, she is our official MVP of the conference. We have decided it. She wins all of the awards. But please feel free to give us feedback. We want to hear from you. Was this helpful? What do you need next time? Do you need more breakout sessions? Do you need fewer breakout sessions? This is an opportunity for you to tell us what is most desired. We'll also be sending out the email link, or the link in an email. So if you registered, just like you did to get here, you'll be able to get an email with our evaluation link. So if you have any questions, please put them in the chat. We're so grateful that you are here with us today. Thank you so much for spending your valuable time. And we hope that this gave you some excitement and joy and some ideas for planning going forward. All right. Take care, everyone. Have a great rest of the week. We so enjoyed being with you.
Thank you, everybody.
Fun.
Bye.